Hey everybody, thanks for joining me on this 5-day challenge to inner strength. I called it that because my main point of interest is the pelvic floor, which often we think about as something inside the pelvis. It kind of covers the bottom parts of the pelvis and then kind of moves up into the pelvis. And I think right now I've been working with the pelvic floor. I've been working with women's bodies for a really long time. And I feel like it's a point that we really, really need to address when teaching and working with women, especially postnatal, and going into menopause. So I wanted to do 5 days just dedicated to this, mainly on a functional level, mainly on how to engage, how to release, and how to incorporate it through our lives so that when we sneeze, we cough, all of these things that we do every day, we don't have any like leakage or anything that kind of starts to happen, especially after we've given birth or vaginal births, and also C-sections as well. We lose kind of touch with the pelvic floor also in those. So I just want to state that 1 in 3 women have some kind of pelvic dysfunction in their lifetime. So if you are having something, pelvic pain, prolapse, leakage, bowel discomfort, sexual discomfort, you're not alone. It's something that I think us as women, we really, really need to start talking about it. And as we move into menopausal years and the estrogen starts to decrease, this is a really, really important, it's important to kind of train these muscles before so that we have the elasticity and the strength and the knowledge to kind of sustain us through these years where, again, the menopause, the estrogen kind of starts to move away, and we have a little bit less support in those areas. So what I wanted to do is I wanted to talk about some exercises. Today I wanted to start really, really small, just finding pelvic floor, because what I've noticed, I've worked with women's bodies for over 20 years, and what I've noticed is we've all heard it. We know kind of where it is, but we really have no idea how to engage and release. And we need to remember, pelvic floor is not squeeze, 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 okay? We need to be able to release. Often I've kind of explored women with like back pain or, kind of discomfort, sexual discomfort or any, these. It's usually because they have an overactive pelvic floor. They're not able to release the pelvic floor muscles. And as we know, any kind of healthy muscle, we can contract it, but we can also release it, right? So the pelvic floor is exactly the same. We don't want this super tight pelvic floor, and then we have to push, because that also creates a lot of problems later on in life. So I'm going to start small today, just kind of teaching us how to feel the pelvic floor, and then through these 5 days, I'll get us up and moving and kind of teaching us how to incorporate breath and like some day-to-day movements that we need to do, and how to kind of keep the pelvic floor healthy. Okay, so today we're just going to start seated on our mat. All right, then you can sit with your legs crossed. Okay, if this is really uncomfortable, you can put yourself in a chair or anything where you can kind of feel your pelvis. Now, what I'm going to ask you to do is I'm going to have you take, now if you're in like yoga pants or some kind of like elastic pants, it's easier, okay, because what I'm going to ask you to do is palpate with your fingers your tailbone. And this is another kind of thing. When I talk to women about tailbone, right, they're always pointing to like, oh, right here. Which no, right? We have to go down, 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 and it's like deep, deep in the like butt, right? Okay, it's right over the anus, right? And you can kind of feel it. It almost feels like a finger or a tail, right? So it's really, really deep down in the pelvic, on the back of the spine. Okay, so I'm gonna have you palpate your tailbone. right? And I'm gonna have you put one hand on your lower belly, right? So you've got these two areas, right? Now I want you to just kind of stack your spine as much as you can. Again, if you need to sit in a chair, that's completely fine, okay? As long as you've got your fingers on the tailbone. And what I'm going to have you do is I'm going to have you lift the pelvic floor. So I want you to almost think, now I'm not going to change my spine. I'm just going to kind of swing that tailbone forward and see if I can draw it closer to the pubic bone. And you'll feel it. You'll feel it kind of slide forward, okay? It's very, very slight at the beginning, and as you get stronger, it gets stronger. Okay, so there's our lift. There's our contraction. Okay, now comes, I think, the even harder part. Can you release? And then I'll kind of slide back into your fingers, and you'll feel it kind of move backwards, right? So it's kind of this kind of movement. Okay, it's very subtle, right? But we really kind of want to train that back edge of the pelvic floor to kind of move forward and up, right? And then back. All right? We're just going to do this a couple of times. So you're going to go forward and up. And back. All right? Now this is a really simple thing to teach women. This is a really, really good place to start. All right? Okay, so we're going to add a little bit of the breath today. Okay, I'll talk more about the breath tomorrow in the second day. But as you exhale, right, I'm going to blow air out. That's when I want the pelvic floor to lift. Think of coughing, sneezing, right? Where sometimes we and we pee our pants. Okay, it's the same thing. We need to get that reflex of pelvic floor engages as I exhale to come naturally. Okay, so you're going to exhale. You're going to swing that tailbone forward. Now I need you to count with me. Don't hold your breath. We're going to count for 1, holding the pelvic floor, 2, 3, 4, 5, and then inhale and swing that tailbone back. Fill your belly with air, opening up the front, back, sides of the pelvic floor. Exhale. Swing that tailbone forward. Counting for 1, 2, 3, 4, 5, and then release. Inhale. Fill the belly with air. Again, exhale. 1, 2, 3, 4, 5, and inhale. Please count with me so I know you're breathing. I do not want you to train the pelvic floor and hold your breath. Again, exhale. 1, 2, 3, 4, 5. Inhale. Opening, last one. Count with me. 1, 2, 3, 4, 5, and release. Good. So hopefully you felt a little bit of engagement at the bottom of your pelvis. You can feel that tailbone sliding forward and back. If you can, it takes a little bit of practice. We're going to do one more time. We're going to go a little bit faster, and we're going to go into these like little pulsations. Again, what I'm trying to get you to do is to retrain that reflex, okay? So that those pelvic floor muscles start to move a little bit more quickly, okay? So hand on your belly, hands on your tailbone. Now, we're going to exhale, lift, inhale, open. So exhale, inhale, exhale, inhale, exhale. Now, I need you to fully release. Don't keep that pelvic floor engaged. Really, as much as you engage, you have to release. And inhale. Exhale. Inhale. 2 more. Last one. Good. And relax. So that's it for today. So I really, really hope that we're able to feel something, right? So that you were able to kind of engage that pelvic floor. Try these. As we go on, tomorrow I'm going to talk a little bit more about breathing and how breathing can help reduce abdominal pressure and can also help with the lift and the engagement of the pelvic floor and retraining these natural reflexes that we lose when we have children or just over time, or again, as we move into menopause and the estrogen just kind of starts to diminish. But this should be a reflex that all of us women have. And again, if you don't feel anything today, this is a trained it's just like any muscle group. You can train these muscles to kind of go back to how they were before. And it's very, very important. So thank you, and I'll see you tomorrow.